So the procedure is done under local anesthetic, but we'll give you something to calm the nerves down, all right? We'll put a very fine needle here. You will not feel it, really.
Right.
So through that needle, we're going to put a wire. The wire goes all the way down in here and rests in the middle of your chest, okay? And through that wire, then we inject some dye from outside. Take a few pictures of the left side of your heart and take a few pictures of the right side of the heart. It takes about 5 minutes or so. And at the end of that, we'll tell you if your arteries are normal or not.
And can you feel
you don't feel
going
anything.
through?
You might feel the traffic through your arm, shouldn't feel the pain. Most people feel pain when they are a bit anxious or nervous,
Right.
so the nerves kick in. Otherwise, if you don't do anything to the arm, it's just used as a conduit, so it's a tunnel for us really. So as I said, that's why we give a bit of a happy juice to help relax people. It goes as a plan, takes less than 5 minutes really. But at the end of that, you know, we'll find out if there's a problem or not. If there's no problem, we close it, we take everything out, put a bit of a band here. You come back here, wait for another couple of hours. When the wristband comes off, we put a bit of a dressing and off you go. That's it. You're not allowed to drive for 24 hours because of the medicine that we give.
Right.
But other than that, from tomorrow you'll be absolutely normal. Even today you'll be fine. It's just that on the safer side, we don't allow people to drive on the first day. But if there is a problem, then the standard protocol is that I tell you that, listen, that there's a problem here on the monitor. I show you, and if somebody's with you, I show them as well. And if we agree to proceed to fix it, then we do it there and then through the same conduit. Most of the time, the process takes 15-20 minutes to fix an artery, but of course it depends on how complex and difficult somebody's anatomy is. So it may take anything from 15 minutes to an hour or so. These are the two likelihoods, to be honest. And I think in your case, I'm expecting everything to be normal. And if so, then that'll be it. The cutoff for treatment is 50%. If there's a 50% or less than that, then we advise to treat medically or conservatively with the medicines or the lifestyle changes or reducing cholesterol and stuff.
I'm with Dr Butt at King's College Hospital, London, Dubai. Because people always say, where are you? You're not in London, we're in Dubai.
We are in Dubai Hills, yeah.
You're telling me I'm boring.
No, I'm not. I just
My
said
heart's
that your
boring.
arteries are boringly normal, so we're going to talk about them. But thank you for coming in today. So we're going to talk about your state of health and your arteries conditions that we performed, the procedure that we performed the other day.
Yes.
So on this screen, you can literally see something beating here. So I'll go... first of all, everything is magnified here, so it's not a real size, all right?
Right.
Do you see that there's a bit of a curve here, something like a little balloon there?
Yes.
Like a breast-shaped shadow?
Yes.
That is your heart actually beating, okay? You can see it as a haze, but it's actually not the muscles. You can see the whole heart beating in a certain way. These arteries, these black lines, all of these black worms, all of these they're literally wrapping around your heart like octopus's legs kind of thing, yeah? So this is my catheter. If I can stop it here somewhere.
So exciting.
So
For me.
see that, yeah. So you see that hockey-shaped structure.
Yes.
So that's the wire. That's the small tube that I put in from your wrist
And
from
in
here
here.
under the local anesthesia.
Yeah.
So it went all the way there. It traveled around your shoulder, and I parked it and then steered it and attached it with one of these arteries. Now, using that as a conduit, I am injecting some dye, and that dye on the X-ray imaging shows up as a kind of a black fluid, all right? So you can see right now you have the arteries, but you don't see any structure there. But once I spill the dye, you'll start seeing it. So it's basically a camera dye test, really. So now this is a real-time live picture. It's a little jumbled up. It's a bit busy picture, but what you can see is that from where my hockey-shaped structure finishes, you're right there, you can see that little a white structure there. That's a little tube. That is your left-sided artery. Now, what you can see, it has a very nice and smooth outline. There's no abrupt change in the diameter there. So right from here all the way down to the end of the arteries, we see the arteries from different dimensions, different angles, to see if there's any eccentric lesions, and if there are lesions, if there are any blockages, how bad are they, and how can we treat them. So different technical aspects to it. However, in the next picture now, you will see the same arteries, you will see it in a different way. The same hockey-shaped structure, and then you see the same arteries are splayed in a different way. So now we are seeing different parts of your heart, different parts of your arteries. So this part and this part was kind of foreshortened in the previous picture, but now they're kind of right in front of us. It's like lying in front of us, so we can really see that. I can see you a bit emotional right now.
I am finding this quite emotional, and because it's such a relief. You don't know what's going on in your heart, and you can be just walking down the road.
You're right.
And it is emotional.
It is actually very personal as well, because a lot of times, in fact, I told you that there's a patient that I was treating even yesterday. Whilst I was treating him, he was absolutely no symptoms. And whilst I was about to treat him, I found in one of his arteries on the right side, there was 90% blockage. And he had no clue about it. And whilst I was about to treat him, his heart stopped. Now, had it outside the hospital, you can imagine the chance of him surviving it. But whilst we were there, so we were there, so we stented him, and today he's going home. And he's all fine.
Gosh, you'd be going home and thinking, that's why I do this job.
We're friends now, so he will bring me socks.
Sock and tie guy, by the way, if you ever want to give Dr. Butt a present.
Right, okay, back to your arteries. So again, we have to see your arteries from different angles. We take like 5 or 6 pictures. So these are the same arteries. You can see that, although you cannot exactly tell, but this is the same side of the heart, but it's just showing a different side of your heart. So this is the largest of all the arteries. This one is. You see it starts from there, and then slowly, in a very natural way, it tapers and all the way down into the apex of the heart, which we call the end of the heart. Then it wraps around it and goes under it. And from it, a lot of other branches come off. So this branch is coming off here, another branch coming off here. All of these arteries, all of them, they're supplying some muscles. Now, any blockage of them would mean that the muscle that particular artery is supplying is at stake. So imagine if your artery blocks here, then this area would be at stake. And if your artery blocks here, then this whole region would be at stake. And that is, we sometimes call it a widowmaker.
What, a widowmaker?
A widowmaker. Yeah, this artery, if it blocks from here, this is responsible for about 60% of your heart muscles. Imagine a sudden blockage of this artery means that 60% of heart muscle just comes to a halt. And the results usually, we know that 40% of people who have a heart attack, they don't, in this day and age, they don't make it to the hospital. The people who make it, 40% of the people who have a heart attack, they don't make it to the hospital. And the people who make it, out of them, of course, the success is varying in different centers, but still not 100%. Some people come with a cardiac arrest. So sooner rather than later, people have to find about their heart health. And this is, I'm not suggesting that everyone should do it, but it is where the buck stops. This is where you know what the state of the arteries are. This is where you know what's what. Same arteries, showing different images again. So in your case,
these black bits.
So yeah, sure. So this one, for example.
Yes.
Yeah. So this is where your artery, like take an example of this wire. So if you see it from here, there's a bit of a knot here. You see it, you can see it simply like that. But if you see it from this angle, you see that these two loops, they are superimposed. So there, the contrast looks darker.
Right.
That's because foreshortened. This part, your artery is going in a different way. It is actually that part. You see that bend?
Right.
Now, if you see it from a different angle, if you're telescoping it, if I could see it, if you were sitting here and you were seeing from here right into that, you would start seeing it darker than usual. You see what I mean?
Right.
So that's a foreshortening effect, nothing else. It's not.
Right.
It's not anything else. So that's the left side of your heart. Now, it's a different structure this time. You see, that's a better hockey, actually. Now, we go on to the right side. In this procedure, what we do, we twiddle it with our fingers and with our thumbs, and we carefully steer it. And these arteries, they come off from different parts of the aorta, and then we carefully engage them with these catheters, we call them. And only once it's engaged safely and carefully, it's like landing on a space station kind of thing. And then we inject the dye. And here...
So there is some risk to this?
There's risk to that, yes.
Which would put some people off having an angiogram?
Well, the risks are dependent on what you're doing it, and what kind of person is being treated. Most of the time, the risk is associated with the bleeding and infection from the site that you performed the procedure on, which I'm sure in your case is perfectly healed without any scars.
Yes.
Sometimes in cases where we have to treat people, those people we have to give extra blood thinners, and then they can have a bit of a bruise here at times. The chances are less than 1%. The procedure itself is quite safe in safe hands. You must have done a fair few thousand before you embark on doing independent procedures.
So you wouldn't want to be number one.
So after you have gone in, then, dare I say it, it's not that difficult. It is the decision making which is more important.
Right.
In a normal person, it took you maybe 10 minutes or so for us to do the procedure. But had you been maybe in different, but you might have had a different experience. So it's important that we perform the procedure with the due diligence, with the best possible outcomes as well.
Right.
But when you do the procedure, and if you find a problem and you end up stenting that patient, then the risk escalates. The risk of death is less than 1 in 1,000 in them. But then if somebody has a 90% or 100% blockage, the risk of dying is way higher than the risk of not doing it.
Yes.
You see what I mean? So
yeah.
on the balance of probabilities, it's better to have it done than not. It is way safer than it used to be, and as we're getting more and more modern equipment, we are practicing safe, and a lot more patients are being benefited with these procedures everywhere in the world than they used to. This is your right artery, by the way, Caroline. This is your right artery. It's a C-shaped structure. So you see that it's that I'm attaching this here.
Yes.
And I'm spilling the dye, and you see that that looks like a swan's neck, right?
Yeah.
So it's dancing literally, and here it's a bit darker because of that foreshortening.
Yes.
And then here it divides into two, and in a very normal way, it casually tapers into these tiny branches, and then they supply to the heart muscles. And once we're done with that, then we carefully remove the tube that we did, and the tube that you had here, we put a band instead of that.
Quite a tight band.
Yeah, it has to be, because otherwise it would bleed into the skin or outside.
Right.
And it takes about half an hour to an hour, but we usually keep it on for 2 hours just to be on the safer side. And once your bleeding has stopped, you get a bit of a dressing. And if nothing has been done, then we usually send the patient home straight away. We do, however, advise that during the procedure, sometimes we give the medicine that people feel might be a bit sleepy, so they shouldn't operate heavy machinery, or they shouldn't drive, particularly for 24 hours. And if we end up doing a stent in somebody, then of course they should ideally stay overnight, but even they can be discharged on the same day.
But they would be so grateful.
I'm sure they will, but yeah, no, it's another life saved, I guess, in that case, yeah.
When would I be checked up again?
As I said to you earlier, that's where the book stops. So your artery's in a pristine condition, and I'm not in a position to predict future, but I would say that if my arteries were like that, I would consider myself safe for another 15, 20 years for sure.
Wow. Wow, I'm going to be smiling all day. Thank you.
You're
Thank you,
welcome.
Dr. Butt.
You're welcome.